Cara Afzal. I'm Programme Director for Digital and Data at Health Innovation Manchester, and I've been working with the team on various digital transformation programmes that help us shape the future of health and care in Greater Manchester. And in today's webinar, we'll be focusing on GMCR EPaCCS and talking to you about how we're sharing vital information with patient consent to deliver improved care. So if you've been on EPaCCS GMCR web pages, you will have heard some views from our patient representatives on how EPaCCS is key to helping support them in terms of end-of-life care planning. And you may have seen John speak powerfully about the importance of planning for end-of-life care planning. And Pat, who is his wife, reminds us that even in death, people should have some control when coming to their end of life, and their wishes should be respected. We know that these are difficult conversations, but it's at the heart of why we do what we do, to make sure that we're delivering the best care for everybody out there. And I was at a presentation delivered by Andy Burnham on Tuesday, where he talked about the importance of Greater Manchester is placing on people living well. And I think key to this as well, we also need to be talking about our commitment to helping people die well, and that's what today's conversation is about. So let me start by introducing today's speakers. We've got Dr. David Waterman, who's a consultant in palliative medicine and clinical lead for end-of-life care planning in Greater Manchester. He's also the strategic clinical network lead, and David's been instrumental in setting up this programme of work. So welcome to David. Our other speaker is Dr. Liam Hosey. Liam is a GP partner and advocate for primary care's role in palliative care planning, so you'll get to hear from Liam as well. And we're also joined by Dr. Saf Ahmed, who is our clinical lead for transformation at Health Innovation Manchester, and has been a key advocate and supporter of EPaCCS end-of-life care planning for a number of years now. And also Andrew Palmer, who is the programme lead for the GMCR project delivery and has been instrumental in setting up this programme of work. And Rachel Jackson Newsom, who leads the GMCR product team at NHS Greater Manchester, who are providing extensive support for the GMCR within Greater Manchester. So you can see this is a truly collaborative effort where we're working together to ensure that we improve how we plan and deliver end-of-life care. So today we'll be covering the EPaCCS Toolkit and how it's been designed to support you in terms of adoption. We're talking about what EPaCCS is, why it's integrated into the GMCR, the benefits for patients and professionals, and how importantly how you can get involved. So I'll come back in at the end to just tell you how you'll be able to get involved. And thank you to everyone for being here. I know it's very difficult taking time out of your day, but I think it's really important to take that time out so we can continue to improve care. Just a few housekeeping things. The session is going to be recorded and shared via the GMCR EPaCCS Toolkit website, which our comms team has set up. And if you could all keep your mics muted, that'd be really helpful, as I said at the start. And we'll have a Q&A at the end as well. And please do post questions in the chat. And can you please encouraging everyone to like the highest, if you like a particular question, do put a thumbs up on that question, and it'll give us an indication of what we need to prioritise in terms of answering those if we've got too many. And so we'll be moving on now to Slido. So if you could keep your phones handy and join the Slido, that'd be really helpful. So in terms of the Slido number, it's up there on the page now. If you could kindly put that into your phones and join the Slido, that would be amazing. We've got a number of questions. We've got 4 questions that we'll be asking. So I'll start those off. Are you already clicking onto those? Excellent. So the first one is, how did you hear about this webinar? Great, see numbers going up. Oh, it's wonderful to see that colleagues have been communicating and cascading the webinar news, which is great. And also can see some internal communications as well. So that's a good indication to us that those forums are working well in terms of communicating with you out there. and also the GMCR newsletter as well. So excellent to see that. Okay, so moving on. Our next question is, what is your level of confidence in using the GMCR? So this is specifically about the GMCR in general. How confident are you feeling? We really want to get a feel out there about how confident people are feeling in terms of use of GMCR. We know confidence levels are growing, but it'd be great to see among people who've joined today's webinar how confident you're feeling. Okay, so we've got a number here very low, so it's 50-50 there, around very low. Okay. Quite high. We've got very low numbers in terms of quite high. Well, we hope that after this webinar, you'll be feeling much more confident in terms of using GMCR. And we've got lots of materials that we'll be sharing with you post-webinar that hopefully improve your confidence and increase your confidence going forward. Okay. Okay, if we move on to the next question, that'll be helpful. So this is specifically around levels of confidence in using GMCR EPaCCS. How confident are you in terms of using GMCR EPaCCS? Very low. That's not surprising. That's why you've joined, to hopefully increase your confidence. Got a number there. Got very, very high. I can't see the bottom one in terms of, I think very high is low. There's no zero there, right? Okay. Quite high, 10%. Okay. Okay, so mostly people are feeling very low in their confidence. So hopefully this webinar will help increase and improve that confidence. Okay, if we move on. And then we're really keen to understand what social media platforms do you prefer for work-related updates. And this is so that we can continue to communicate with you. So if you could click on what you use in terms of communicating, communicating and learning about work-related updates. Oh, interesting. Facebook. Oh, surprised by that. That's great. Okay. And TikTok. So we've got some TikTok users in there as well. And LinkedIn. Okay. Other, now in terms of other, if you could just put in the chat what other forums you're using, that'd be really helpful in terms of getting updates, because that'll help our comms teams in terms of understanding what other forums are being used. Okay. Great. That's been really helpful. Thank you for that insight. It's always helpful. We are going to be sending out a feedback form at the end as well. So we'll be getting more data and information. So, okay, so we've got some colleagues talking about email in the chat, and some colleagues don't use social media. So we'll bear that in mind. Right, okay, so let's get into the meat of the presentations. I'm going to pass you over to Andrew Palmer, who's going to give you a brief introduction, and then we'll pass on to other colleagues as we progress, and I'll come back in the end. Thank you, everybody. Thanks, Andrew.
Thanks, Cara. Thank you, Cara. And hi, everyone. Thank you for joining us today. I'm Andrew Palmer, the Programme Lead at Health Innovation Manchester for the GM Care Record. So the GMCR EPaCCS project and the toolkit we're talking about today is being led by Health Innovation Manchester and working in partnership with NHS Greater Manchester and the Greater Manchester and Eastern Cheshire Strategic Clinical Network. Health Innovation Manchester here, we bring together the region's NHS, local government and universities to accelerate innovations that improve health outcomes and reduce inequalities. So our role in leading this work is to bring people, data and systems together and turn proven evidence-based innovations into real-world impact. So this project is part of the wider Greater Manchester Care Record programme, our region-wide shared care record. The shared care record enables health and care professionals across all 10 GM localities to access timely, joined-up information from all areas of the system to support better care. We're delivering this project into early 2026 with the core aim of increasing the usage of EPaCCS in Greater Manchester and enabling use of it across all 10 GM localities. The Greater Manchester Care Record itself is today accessed by nearly 25,000 different users every single month, who are accessing nearly 400,000 patient records every month too. So we are accelerating and the usage continues to rise across the region, with over 20% year-on-year increases in all areas of usage of the care record. Alongside this, we've reached new milestones this year with the use of EPaCCS in GM already in 2025, and now have over 15,000 GMCR EPaCCS created across Greater Manchester and over 6,500 live active care plans as of today. EPaCCS itself is a national model to ensure people approaching their end of life have their preferences recorded and shared across care settings. So it's about putting people's wishes at the heart of care, no matter where they are in the system, and using the GMCR to do this. In Greater Manchester, this journey started with the Strategic Clinical Network, who led the early work on EPaCCS in GM and coordinated those first projects. They brought together clinical leaders and supported local testing to understand how we can make this work in practice, and really laid the groundwork to give us a strong foundation to get to where we are today. So working together with the SCN, NHS GM, clinical teams and digital leads, suppliers, and most importantly, patients and carers, we've developed a practical EPaCCS toolkit, which is tailored to Greater Manchester. It includes all of the information you need to get started using EPaCCS via user guides and videos, materials to build awareness and implementation support, and resources to help localities embed EPaCCS in a way that's consistent and sustainable. So today's launch is that first step forward, moving from local isolated projects to a joined up regional approach for Greater Manchester. So thanks for joining us today, and I'll hand over to some of our clinical colleagues to take us through the next set of slides.
Thanks, Andrew. So my name's Liam Hosey. I'm a GP in the centre of Wigan, and as Cara said at the start, I'm the primary care palliative care lead for Greater Manchester East and Chester Strategic Clinical Network. The next few slides, I'm sort of going to go through them, but also with my colleague Dave Waterman in at the end of each slide, just to sort of give a bit more context to what we've discussed. So I guess some of you may be here thinking, what is EPaCCS and what does it stand for? And in the medical profession, we love an acronym, don't we? We love abbreviations, and perhaps our first test is to say, well, how many people actually know what it truly stands for? But it's electronic palliative care coordination communication system. It's a system of sharing information about our patients. Now, I don't know what everyone's role is who's joined this webinar. I've recognised a few names of people who have joined, but I think we've got quite a broad representation of our workforce. And I guess the vast majority will recognise that when things are difficult within health and social care, the primary problem seems to be something around communication. Now, that may be communication between the patient carers and the professional, but it may be communication about sharing information. So who knows that information? So any system we can have that improves that information sharing surely is going to have some benefit. So the EPaCCS system is a way of sharing some key information, and you can see on the bullet points there's some very important information that maybe I might know as a GP. I might know what the carer's details are. But what happens if one of our district nursing colleagues goes out to see that patient and they need a contact? Do they have that information readily available? Is there a way of sharing that? Clearly, there's some very important information that needs to be discussed and shared regarding our patients who are reaching the end of life. Things like cardiopulmonary resuscitation decisions and information, what that patient's preferences of care may be, where they want to be cared for, and what they perhaps want to happen, and perhaps even more important, what they don't want to happen as well. So just before we move on, Dave, is there anything you'd like to add on that?
Yeah, thanks, Liam, and thanks, everyone. I think it's just worth recognising that we all have our own clinical records, whether that's digital or paper. We're clearly able to share between digital records in some localities as well. But what EPaCCS offers is, as Liam says, that key information to be readily available following discussions and agreement with patients about what they want, and for the clinicians and health and social care staff to be able to see what they need to see when they need to see it. Thanks, Liam.
Thanks. We could move to the next slide. So thank you. So it can be quite sort of bewildering when you think about the number of people who are actually involved in a patient's care when they reach the end of life. I think this diagram really does try and do some of that justice. And actually, if you started to try and draw lines between all of these people, you can see just how difficult it can be to communicate and to share information. So the EPaCCS system via the Greater Manchester Care Record is a mechanism of doing that. So it's a as Dave's already alluded to, it's a place where key information can be shared between key individuals or organisations that need to see that information. What it isn't, again, we have to sort of reiterate this, it's not a new single shared record that everyone can access and input into, but it's more a system of sharing that key information and that important information that helps guide that decision-making processes. I think many of us probably have that sort of Friday evening scenario, don't we, where we're called to see a patient that we don't quite know what their up-to-date diagnosis is, what their plans may be, who the carer's details are, etc. And if we have a way of everyone being able to access stuff that they need to know in a timely fashion, clearly that can benefit us as health professionals, but actually, benefit the patient and their families as well. So, Dave, anything more to add on that slide?
Yeah, I think it's just really important to say that the GM Care record has lots of other information on, as well as the EPaCCS. And I think that's the real opportunity with a shared central repository of information that is the GM Care record, is that EPaCCS and that end-of-life care information sits within that other information as well. So it gives us an opportunity to find the right information when we need it, from other sources, but also the EPaCCS as well.
Thanks. So I think we've already touched on a little bit of this as we've been sort of moving through the last few slides, but why is this important? How can it benefit for us? Now, I think as clinicians, we know we need information to help make decisions, and the more information we have, the easier that decision is to be made, and also the more informed that decision can be. If we know about patient and carers' preferences and wishes, we may be able to avoid things that they really don't want to happen. So I guess the obvious thing within palliative and end-of-life care is lots of our patients will say, I really don't want to go back into hospital. And if we know about that, then we really can try and do things to help support the person achieve that wish. Granted, there may be times when that's not possible. There's many, many reasons why that can happen, as we know. I think one of the key areas around EPaCCS is, I think in its early iterations, it was a very cumbersome system to try and navigate and access. So over time, real clinicians have really said, look, we need a single sign-on. So if we sign into our own EPR or clinical system, we need to be able to click through into the EPaCCS system whenever possible. So that has been enabled now. From a GP perspective, we can also use a few other functionalities of EPaCCS. So it can actually give us, if we've created EPaCCS records on our patients, it can actually give us a list of who those patients are. So that can help sort of inform and support gold standards framework or palliative care meetings, whatever terminology we wish to use. Now, moving on a little bit to sort of how this may benefit individuals, I think Cara sort of hinted right at the start there are some really powerful patient testimonies to the importance of information sharing. And we do know, and I'll make no apologies for saying this, we'll say it again and again, but to find out people's wishes, so to think about the wishes is then somehow discuss them and record it and share it is clearly the basis of care planning. And this system can be so important in helping achieve that. Now, I think the second bullet point on the individual's bit of this is perhaps one of those key things. And I think if we ask our patients what really frustrates them, it's perhaps having to give the same information time and time again to different health professionals. And they sort of think, well, I've already told you that, or I told the last person that. So, why do we really need to ask the person or the family for the 10th time, oh, you don't want to go into hospital, do you? So if we can, reduce repetition, actually it's better for everybody. As we've touched on already, if we know what people's wishes are and what their preferences are, it means as health professionals we really can try and help achieve that in the vast majority of cases. Because simply, if we don't know what people want to happen when they reach the end of life, how can we help make that happen for them? So Dave, anything more to add on that one?
I think just reflecting on an individual and how many professionals are likely to be involved in their care across hospital, community, hospice, primary care, and others, both in hours and out of hours. I suppose it's really important that we have a mechanism where we can share that key information in a timely way that's readily accessible. And that's clearly the aim and the benefits of an EPaCCS system.
Thanks, Dave. So how do we sort of go about this, some practical bits? And I guess, like anything, it's about firstly identifying the right group of patients. Now, in GP practices, we tend to hold registers of palliative care patients or those in need of additional support from ourselves. And that's probably a good starting point. But there may be other patients that we become aware of that aren't yet on that register that are developing palliative needs. Now, this webinar today, I guess, is about a system, okay? And I think we need to be really careful as health professionals to not make all our thoughts about the system and still recognise that what we do is about communication, it's about personalised care, it's about talking to that patient and their families and finding out what they want and need, and not to forget the basics of good communication within that. But we can use that to our advantage, can't we? When we've got people that we think have palliative needs or been identified as in the last 12 months of life, it's a conversation opener, isn't it? In a way, look, things seem to be deteriorating. What are your thoughts? How do we share those, etc.? The basis of EPaCCS, really, we should have patient consent for these, but of course, there are some cases where patient consent for sharing that information isn't possible, maybe due to the lack of capacity. So there are sort of caveats to that where we can make sort of best interest decisions, and we may come on to that in the demos a little later on. And just a little bit about the practicalities, and again, we will probably see this, that the way the EPaCCS system does work is it can pull out key information from clinical records and add that to the GMCR record in the EPaCCS system. There's the opportunity to add some more information as well. So some of that sort of more granular detail that we put in free text may be important to add into the EPaCCS system as well. But we'll come on to that in a sec. Dave, anything further to add on that one?
I think I just want to reflect, as you've done, Liam, that the start of the conversation could be done by many different professionals, and to give that individual an opportunity to voice their wishes and voice their preferences. And therefore the EPaCCS can be used by a number of different professionals because of that. So it's not just one group that can start that conversation or build on the conversation. It's a collective effort where we can help each other.
Thanks. So this isn't a Slido question, so there's we don't need to participate in this, but there's just one or two things that I think are some myths that we just like to sort of flag a little bit. So if you could put the first one up, please, Andrew. So GMCR is a duplication of work, and as we've said already, it's not replacing our own electronic patient record. It's a way of getting a summary of the key information and adding it to a system where people can readily see it. Clearly, there may need to be some additional information added to supplement the information that's automatically pulled through, but it's not a duplication of full workload. So we don't have to write everything in our EMIS system or System 1 system, for example, and then duplicate that in another system. So next one, please. Now, the very observant of you would have already heard Dave answer this one already. I think something as a GP that strikes fear into my heart is the phrase GP is the best place to do. We are best placed to do many things, but actually we have to accept there's many other health professionals that are involved in that patient's care, and they're absolutely able to start the conversation around EPaCCS and create those records and begin sharing those. So there may be other people who are far more involved with a patient than a GP that can start that process. If you could bring the last one up. And again, this is a very sort of common question because those of you who haven't seen the EPaCCS format may sometimes be quite overwhelmed when it's first opened. There are a few mandatory fields that do need filling in, and it won't let you save the document until those have been completed. But there's the opportunity to go back and amend and refresh the plan as time progresses. And this is just like any sort of palliative discussion with our patients. You don't have to do everything all in one go. There's time to come back and refresh and revisit information. So Dave, anything to say on those?
No, I don't think there's anything to add on those, Liam, so we can hand over to staff now. Thank you.
Brilliant. Thank you very much, both. Hi, everyone. So I'm Saf. I'm a GP by background, and I am the clinical digital lead for transformation at Health Innovation Manchester. So today I'm kind of put this slide up to show you the scale of the work that we're doing across GM, which is to get EPaCCS implemented in all 10 localities, and we have got the buy-in now from the entire system around the use of EPaCCS on the GMCR. So we have been going kind of to the ICB, to our chief officers, to our KEGs, to locality boards, to deputy place-based leads, to CCPL groups. So we've been everywhere to talk about the EPaCCS care plan, and we have got really strong clinical buy-in across our system now to implement this. Now, what's the size of the prize? We're looking to get 1% of the GSF register to have an EPaCCS care plan. So that 1% would account to about 22,000 care plans for Greater Manchester. As Andrew said in the previous slide, we're up to about 6,500. We've got different in kind of maturity of localities and where they are on their EPaCCS implementation journey. And Bolton were very much started the journey back in 2022 and have hence had quite a lot of care plans done. We're going to kind of overtaken that recently with a big spurt in kind of EPaCCS care plans, as it is being put into one of their local enhanced services for primary care as well. But what we're seeing is that there has been also some differences and shift in work. So what we're starting to see is that it's not just general practice that are completing EPaCCS care plans. So in Salford locality and Bolton locality, for example, we're seeing 40 to 50% of care plans being completed outside of primary care. So in the trust, community services, hospices, and we're starting to see that in Tameside as well now, as they've just launched recently around EPaCCS across their system. And one of the big things that I'd like to emphasize here is that this is very much a system piece of work. So it's a very big piece of work in terms of getting everyone on board. And we're talking about primary care, secondary care, community services, making sure that NWAS are involved, making sure that out of hours have that information. So it is a big project. So we envisage this to last around 12 months, this project, to try and get everyone implemented and really embedded on the GMCR EPaCCS care plan, and to really improve that quality. And why? It's because what we've started to see, so the evidence base shows us that having an EPaCCS care plan is likely to improve your preferred place of death to around 85%. EPaCCS has been around for about 14 years now. It's not new. And one of the things that we've seen on a small cohort that we measured that had a GMCR EPaCCS care plan, their preferred place of death was achieved 86% of the time. The GM average is actually at 42%, the national average at 52%. So it shows a huge benefit for those patients. One of the other things we've been doing is talking with London. So they have what they call the Universal Care Plan, which is very similar to the EPaCCS care plan. They've embedded that across Greater London now, and they've seen a big improvement in preferred place of death to around 70%, but also a decrease in conveyances. So they've gone from 46% conveyances to 30% conveyances of those patients at end of life. So those people are being cared for in the right place and not being conveyed unnecessarily. So that's one of the big reasons why we're wanting to do this. And just to give you a stat that always amazes me, and I heard this for the Amanda Pritchard's team had looked at the 1% GSF currently make up 30% of inpatient beds at the moment within hospitals. So that's, we'd be able to potentially close 5 hospitals, she said, if we were actually looking after those people properly, managing their wishes. And that is a big stat for me. So if we go to the next slide. So what have we done with the help of all our colleagues across the system, and this is very much a system effort. We've developed a GMCR EPaCCS implementation toolkit, and this is based on all the learning that we've had across implementing EPaCCS in different localities. We've heard from different clinicians and people what their struggles were, what they found difficult, what they needed, and we decided that the best thing to do for GM was to create that toolkit. I'm hoping some of you would have seen that. It was launched in the GMCR newsletter only a few weeks ago in Dying Matters Week, and I'm sure some of you have been through it, but my plan is just to show you that toolkit now and just show you the kind of the things that we've done. So I just need permission to share, actually, Andrew.
One sec.
Sorry. But yeah, in terms of the actual toolkit itself, it's been real good work, I think, amongst all of the clinicians, Dave's group that's been established for some time now, and all of that rich wealth of information that we've used to actually develop this. It's not, there we go. Okay, you're sharing it. Okay, so you have to bear with this. Technically, I'm not able to share for some reason, so I think Andrew will just have to share for me. But this is the toolkit. It tells you information around what is the GMCR EPaCCS, why it's there, and then there's an introduction. There's some videos on here that I urge you to watch from David, Liam, some of our patients across Greater Manchester, as why the GMCR EPaCCS is so crucial and why we're doing this across Greater Manchester for our patients. One of the things that I would point you to also look at is, if we move down, we have a number of resources that we've developed. So these are all the videos, and then there's this, which is the getting started. So if we click on that for me, thanks, Andrew. So what we've done here is divided this into 3 simple steps for people. So there's building the awareness, which is there's posters in there, a ready-made presentation for you to use within your own localities, and then there's also some information on the website that you can share in that infographic. So all of those resources in terms of building an awareness, you can put up in practices, you can put up wherever you can, so that people are aware of the GMCR EPaCCS. The getting started bit has got a lot more resources in it. It's got that quick start guide, so it shows you how you can start a GMCR EPaCCS, what's the best, how you would do that from your system. So just to mention, in terms of the GMCR, for those of you have never used it, every clinician in Greater Manchester has single sign-on access, which means that when you're in a patient in your record, you will be able to go into that patient's GMCR record by clicking on it's called the GraphNet portal on EMIS, for example. But when you click on that, it will open up the shared care record, and you'll be able to go and see the EPaCCS care plan. There's some top tips there for implementing the GMCR EPaCCS. We've talked about some of them today, but in terms of just the way you would engage your stakeholders in the locality, how you would plan that cycle of implementation, and what the do's and don'ts are around some of this stuff in terms of what we've learned. And as a team at Health Innovation Manchester, we can help with implementation. So please do get in touch whenever you're trying to implement the EPaCCS care plan in your locality. And then the planning resources. So the planning resources have got lots of information in there around process maps, this is just how to get onto the GMCR. But then going down, we've developed process maps and workflows for each of the care settings. So whether that's in general practice, for NWAS, the hospice, obviously, and then district nursing and specialist palliative care teams. So we've developed and worked with people across the system who are erudite in all of this information and are able to tell us how the process would work around implementing an EPaCCS care plan in each of those clinical settings. The other useful resources that we've got, if we go down again, sorry, Andrew. So just here, and we won't click on all of them, but just to show you, there's an implementation checklist that will allow you to just do this in a more systematic methodology, and we've developed that based on all of the feedback we've had in terms of how this can work. So if we just click on the implementation checklist, Andrew, thank you. So as you can see, it's very simple, and that was the key for this toolkit, to keep it simple, not too complicated, and to make sure that anybody can use this toolkit within their locality to embed EPaCCS. Thanks for that. If we go back, and then the other useful bit here is the more resources, which is the step-by-step guides to creating, updating, emailing, and finalizing EPaCCS forms. So all of these videos, and I'm not going to go through all of them now because they're about 5-6 minutes each, but each of them will show you exactly step by step how to complete that EPaCCS care plan, how to update it, and also the finalization of that. And just on touching on the finalization of an EPaCCS care plan, it's not really done very often at the moment, and we're finding that so only 10% of our EPaCCS care plans are finalized. And what that means is that once someone has passed away and you put in the after death information, you can click finalize, and that's finalized the form altogether. The importance is doing that is for the analytics in the back end, really, because then we can work out whether that patient had a preferred place of death. We can also look at all of the information in there and be able to dashboard that for locality. So it's really key that we finalize those buttons. In terms of process to doing that, that can be an admin person that can finalize the EPaCCS. Doesn't have to be clinical, but I'd urge you to have those conversations within your own workflows to work out how that would be done. If we go back to the main page, and then what we've also developed at the bottom here is we get lots of questions around why EPaCCS, do I dual entry, which codes are pulled through. Now, all of that information is provided in the frequently asked questions. So we've got bits around getting started, then creating and editing an EPaCCS care plan. And this is based on the feedback that we've got from clinicians across Greater Manchester. And all of those questions are there to be answered. Obviously, if you guys go through this pack and find there's things missing or anything that we should have added or any FAQs that you feel should be in there, then please do contact us and we'll be able to add to this, because this is an iterative process, and if we need to improve the care plan, we will. The implementation toolkit we will do. Now, just in terms of getting in touch with us, so at the bottom here, there's a link for you to get in touch with the team at Health Innovation Manchester, and we can provide support on implementation. Now, that support comes in the form of coming to your clinical groups, showing you demos of the EPaCCS care plan. We can help with communication. We can help with the IG. We can help with the resources needed to get your clinicians onboarded to the GMCR. So it's that full implementation. And we use the toolkit as a basis to do that. So I think that is the toolkit, and it obviously we'll have time for questions, but I would urge you to look at it, go through it at your own leisure, give us some feedback. We're really keen to hear from people. Initial feedback has been very positive, but I'm also keen to hear if there's anything we've missed or anything you feel should be in the toolkit. Now, moving on to the GMCR EPaCCS itself. So if you just stay here for a second, Andrew. So if you've never been on the Greater Manchester Care Record, this is the landing page, and you will see which patient it is at the top toolbar, and you can click the down arrow at the top by the toolbar, and that will give you all that patient's demographic details, who they're registered with, and it pulls from the spine. Now, the bit that Dave was alluding to around the value of the GMCR, not just for end-of-life care, is the information that it holds. So it pulls in information from all 414 practices across Greater Manchester, and also 10 trusts, 10 local authorities, and also our specialist trusts. So you can see, so there's a tab there that says results. So within results will be all of that patient's blood results that they've had, whichever hospital they've been to across the system. And you can see that, so you're not duplicating tests. You can also see any scans, any radiology reports, all pulling through. Now, activity is a useful one, I find, as well. So if we just click on activity, Andrew, which shows you where that patient has been in the system, whether they've been in hospital as an outpatient, as an inpatient. You can click on these further for detail, and then whether they've been to A&E. And if you scroll down, it also shows you the GP encounters. Now, that's very useful in the fact that it's able to give you a picture of where that patient's been in the system. And I use that quite a lot on the GMCR. And a lot of you will probably, who aren't in general practice, use it for meds reconciliation, because it will give you a live, up-to-date feed of what the medications are. So if we go back up the page, Andrew, please, thank you, just to GP information. So these are the navigation tiles at the top, and if you click on those, you can see straight away the information comes up around repeats, medications, and this is really important in end-of-life care when you're looking at that patient and trying to figure out what's going on with them in terms of where they've been in the system, but also what medications they're on. And it also obviously pulls through is the GP problems, active, past, any clinical findings. So all of that coded data, all that rich information is in one place for you. And it's really important when you're making those really important end-of-life care decisions, because you've got the full picture of that patient. Now, if we go back to the main landing page, so just to show you, if you do have an EPaCCS care plan, because it's so important, it is front and center on the landing page. So it will show, just like it does here, that there's an end-of-life care plan. But if we just show you how to get to one, if there isn't one. So as I said, there's the care navigation tiles at the top. You click on care plans, and then this will show a variety of care plans that we have across Greater Manchester at the moment. But then you can see straight away the end-of-life care plan, which is EPaCCS. And if we go to click on that, Now, I'm not going to go through the entire EPaCCS care plan right now. The videos, as I've mentioned, show you the end-of-life care plan and how to complete one, but this is essentially how you get to it. And then all of the information is there. This is the newest version. It's called version 4. It allows you to go down to specific areas and see all of that information and input all of that information for that patient. So it's really, and as again, Liam and Dave were saying, no need to fill all of this in for one person. If you've got specific information that you'd want to share around that patient, please fill it in, because any information shared across the system is really, really useful to improve the standard of care that we have across Greater Manchester for these patients. So if we stop sharing that now in terms of the GMCR, I think if we just go back to the slides. Thank you. If we just go to the next slide. Brilliant. So just wanted to end with just the support and implementation engagement. I've already alluded to the fact that we've got a link there in the toolkit for you to press on, but then just a little bit about new developments. So we already have a My GM Care app across Greater Manchester that we've launched. We have a roadmap to implement having the end-of-life care plan on there for patients, so patients are able to view that end-of-life care plan. And future developments would be that they would be able to add to it as well and be able to edit it. Now, we're not going to be the first to do this. So unfortunately, London are ahead of us on this. Their universal care plan has been integrated into the NHS app, and you're able to see your end of life kind of details there around DNA, CPR, preferred place of death. So that's exactly what we want to enable for our patients across Greater Manchester, and that work is underway. And we're also speaking with the NHS app team to integrate our My GM Care app into the NHS app as that single front door. And then the other bit was, so NWAS are able to see care plans in their clinical hub at the moment, but their 999 teams aren't able to see that. So what we're doing at the moment is working with NWAS to develop a single sign-on, that's the SSO, so that they're able to see all of the care end-of-life care plans, even at that level when patients are called 999, rather than having to rely on calling a clinical hub or calling out of hours to see it. But now we're starting to get that real kind of momentum with EPaCCS care plans. It is in the primary care blueprint. Out of hours have got it in their policy to look at EPaCCS on the GMCR. So we're really starting to get that. So the more EPaCCS that are completed on the GMCR, the more people will use it and the more people will look. So it's kind of building that momentum. And we're really keen for you guys to start really using it now and adding that detail in for patients. So I'll stop there and we'll go on to questions. Thank you.
Thanks, Saf. So we're just going to pass over to Rachel. We're running a bit behind, but Rachel, do you want to kick off?
Yeah, so hi everyone, I'm Rachel Jackson, the Senior Product Manager for the GMCR and working for the GMICB. The product team is responsible for all ongoing development, enhancements, training and support for the GMCR. As part of our support offer, we provide face-to-face or virtual training, so we'll work around the needs of your team, whether you want us to join a Teams meeting or it's slightly out of hours that you need that training, we can provide that support. Assistance with how-to or technical queries, and provide a range of training materials and resources as well after you've had the training. If you do have any training requirements or need any support, then please reach out to the GMCR product team. That the email address is on the screen. For any technical issues that you might experience, such as errors, access problems, then please ensure that you contact your local IT help desk. If you're unsure how to do this or you've not had a response from your IT help desk, like an update, then please do reach out to the product team again and we'll do our best to follow up there. We have got some new developments with a non-PID dashboard for reporting, which is which will be available soon. But in the meantime, while we're just still working out the access requirements, if you do have any reporting requirements, then do reach out to us and we can provide them figures for your practice or your locality. Thank you, Cara.
Thanks, Rachel. So thank you to all our speakers today. I'm hoping as colleagues that joined the call today that you're feeling better informed now about EPaCCS and what we're doing in terms of enhancing care delivery in Greater Manchester. One of the things that I wanted to cover off today was that we can't do this alone. It does require leadership and champions out there that are banging the drum for EPaCCS. You know, we really do need to work together on this. This is a team effort that we'll need to put behind moving this forward. So we're quite keen to identify EPaCCS champions. So there's a short role descriptor there in terms of what we're looking for. So I do encourage all of you to think about joining and becoming a champion. You can register your interest by scanning the QR code, which you'll be able to see there, and these slides will be shared afterwards, so you can actually have a think about it if you need to take time. And you can also email for more information at comms@healthinnovationmanchester.com. So please, I do encourage you to become a champion, because we can't do this by ourselves. You know, we've got quite a big patch of 10 localities to cover off. So please do put your name in the hat in terms of becoming a champion. So just moving on now, we want to take some time to do a Q&A, because I think it's very important that you get an opportunity to ask any questions you've got. So I'll move over to some of the questions that we've got in the chat. But if anyone wants to put their hand up, do that, and the team will be monitoring that, and we can bring you in at the right time. So the first question we've got is from Sue French Islam. Thank you, Sue, for your question. You've asked about if a patient passes, you can add information to the EMIS record. But you're asking the question, can we still also access EPaCCS if the patient has passed? So you can enter any information, because you don't always get the relevant documents available when you close the record. So I don't know whether, Dave, are you able to answer that question?
I think it's more a technical question of when you lose your EMIS record, because I think while you've got a record that you can single sign on from, then you're going to be able to see that record. It will be, if you're in a practice, for instance, and the EMIS record is closed, that's obviously through single sign-on, you're not going to be able to click through to the GMCare record in itself. So I don't know, Rachel, if you've got anything to add to that, but I think it will be there while you've got a record to link to.
Rachel, do you have anything to add? Thank you, Dave.
Sorry, I missed the question. I was reading some of the comments in the chat.
Oh, no worries. It's about whether you can add information to the EPaCCS, because at the moment, when the patient passes, information can be added to EMIS just to complete the record. But is it okay and possible to add any information to EPaCCS when the patient has already passed?
Yeah, so you do remain to have access once a patient has passed away. So you can go in, edit, add the death data, and then finalise the plan once a patient has passed away.
Thank you. Thanks, Rachel. The other question in the chat is, are appointments automatically pulled from EMIS or need to be inputted separately? Do you want to pick up that, Rachel?
Yeah, so are we talking about GP appointments or hospital appointments? Both do flow through from secondary care and primary care into either the secondary care tab or the GP information tile.
Great, thanks. And Caroline, if you've got any further questions on that, just do put it in the chat. Okay, just let me to go on the online now. Who's got the hand up? Syed Shah, can I bring you in? Then we'll go back to the chat. Syed, do you have a question? I hope I pronounced your name correctly. Oh, Syed, you're on mute. You're on mute. Oh, we can't hear you. I can see you, but can't hear you.
Okay, sorry, because you did it yourself. So I've just answer that question. That can you see or edit the record for the for the EPaCCS after the patient passed away? The answer I know is no, because obviously once the patient passed away, I'm talking about the patient who passed away in the hospital, you cannot actually access any records. You can actually access your own record in the EMIS. Even if the patient passed away and become deceased on our system, we can still go into it. We have to give our reason. But once the patient passed away in the hospital, I'm not sure about in the community, because, and I think it's probably the same thing. Once it goes into the system, the patient passed away, you cannot actually access the system because you can't access blood results or anything at all. So that's my understanding, and I've got my own experience about it. You cannot go into it once you've done it. I'm not sure, Rachel, is that you having experience, or is it true that we can access it? But to my knowledge, you cannot. I'm not sure. So, Liam might have got an answer to this as well as a lead.
Okay, so let me bring Rachel. We can look at things outside the meeting as well. Sorry, Rachel, do you want to come in?
Yeah, just to add, so what we do is we add what we call a ZZZ code to your user account so you can access the deceased patient. So when you're talking about like hospital blood results and things, so that might not happen with systems like ICE, but we do give you that access after death. If you haven't and you can't see the patient, then do let us know, because we might just need to apply it to your account.
Okay, that's fine. Now the question, I was just commenting on this one. So the question is that what is the minimal requirement? So it's always very frustrating that we are crunching the numbers. I'm not disputing that we have to do it, but I think what we're doing is we're crunching the numbers where we have done a local DES as well, that we have to do is it 1% of our population to be on the palliative care register. I always be very careful putting a patient on the palliative care register because it's a very obviously the last thing you want to do is for the patient, but some people need to go on to that. So what is the minimum requirement to tick the box that we actually go into the numbers into a 1% area? That is it just the diagnosis, that was the patient diagnosis it, and the DNA CPR, or we have to do more than that for that? Because you see sometimes you feel that the patient is stable, like patient in the residential home or a nursing home. They are stable, but they all have a DNA CPR because they're above 80, 90. Obviously they have a fluctuation in their day-to-day health. Basically, sometimes they don't stop. They stop eating and drinking, and so it's going downhill. And we all know as clinicians that sometimes what happens is that one patient today, she is quite perked up and everything, and next day she will be down. So sometimes I do obviously session intent for one person, and it lasts for 2 or 3 months, and then I have to take it back. So I just want to know about that. Thank you.
Thanks, Syed. I suppose there'll be clinical judgment there. So, Liam, David, did you want to pick that up?
Yeah, I can start. Liam, I'm sure will follow. Yeah. So, I think the first thing to say is EPaCCS is about sharing clinical information. And that's about clinical discussions with individuals and decision making with that individual and then sharing. So I think that's important. It's not number crunching. And I think important to say we start with the clinician. I think in terms of identifying people where you might start that conversation, and that I suppose is we know that on average about 1% of primary care population will be in the last year of life. That's a rough indicator of where do you give people the opportunity for that discussion. But actually, we also know that depends on your practice, it depends on the size, it depends on other aspects you have from your care home. So I think it's really just to say that what we're encouraging is a clinical review to feel, has this person got palliative and end-of-life care needs? Would they benefit from an opportunity to just discuss their wishes and preferences? And once we document that in our own system, would it be helpful for others to see that information as we've already had that discussion? And that's the purpose of the EPaCCS, is to allow that sharing of that key information and discussion once we've done that clinically.
Great, thank you, David. Okay, so thanks for your question. Okay, let's move on. We've got quite a number of questions coming up in the chat, so thank you, everyone. If we don't get around to answering all the questions, don't worry, we will get back to you on all of them after the webinar. So, question here around DNA CPR. Does it need to be inputted separately from EPaCCS? Who can pick that up? Saf?
Yeah, so if you input the DNA CPR in your EMIS, it will pull through into the EPaCCS care plan. But there is a box also that you can tick to say that it's been done. It doesn't pull the actual DNA CPR because it's not digital, because that's a paper form, obviously. It's a record that it's been done.
Great, thank you for that, Saf. another question. I think this will be a straightforward one. Rachel, is this training available to hospices, please? So is the EPaCCS training available to hospices?
Yeah, it's available to all users.
Excellent, thank you. Okay, so I've got a question about going back to the QR code on the last slide. We will go back to that. That's not a problem. It's up there now. So, okay. Right, I'm just conscious of time. So, we've got one here where, you know, we've got a couple of people that give thumbs up. So I'm going to ask this question. I am one of the transfer of care nurses. Our team facilitate a lot of fast track and palliative discharges from hospital. I access GMCR for information purposes, but I think my access is possibly view only. Input anything. Is there a specific login to be able to input information? Rachel, can you pick that one up?
I'm guessing this is a Manchester user. Does it say where the user's from?
So is it sorry, Savannah, do you want to speak up? Can you clarify
MFT user
where the users are from?
Barry, I think.
Is it Barry?
Yeah.
Barry?
It will just because different localities are at different stages of this EPaCCS rollout. So if your locality hasn't fully rolled it out within all the organisations, then we'll just need to update the permissions once it's agreed locally.
Great, Rachel, thank you. Dan, Alexander, do you want to add anything to that? Sorry, Dan, you're on mute. Oh, can't hear you for some reason. Okay, just put it in the chat, Dan. Sorry, there must be technical difficulties on your side, can't hear you. Okay, I'm going to take another question that's got a couple of thumbs up on this. So this is from Emily. So I'm a GP in Bolton. We currently share information about our palliative care patients with Adastra. And if we put everything on EPaCCS, do we still need to share information via Adastra? Who can take that? Oh, I think Rachel's frozen. Saf, would you know the answer to that one?
I can. Yeah, sorry, I'll be on frozen.
Sorry, you're back. You're back. You're
So
on frozen.
we need to carry on with the current processes of sending it to Adastra until then processes have been embedded with the out of hours service to ensure that they are going on checking around for that documentation.
Great. Right. Sorry, everybody. We are running out of time. Thank you, everybody, for your contributions. There's lots of questions coming through, and I promise that we will pick these up after the webinar's over and get back to you. And we also have a newsletter, so please encourage everyone to sign up to the GMCR newsletter as well, where you'll continue to receive information. Now, we're just on the final slide now, and we've got a QR code here for any feedback. Really keen to hear from you in terms of feedback on the session and any other information that you will be happy to share with us in terms of how well we're doing in terms of the EPaCCS rollout. We really welcome your feedback because we don't know what we don't know. So we're keen to plug into how you're feeling about the rollout. And if there's any additional information and feedback on the materials that we provided, we're very keen to hear about that. And the information, the link to the information on the website is there as well. So please encourage everyone just to go on there and have a look around all of that information and materials. And I want to finally thank the team for all the effort they put into pulling this webinar together. So thank you again. I'm sure our paths will cross again in some future webinars that we'll be putting on as well. So thank you, everybody. I'll draw the meeting to a close. Thank you.
Thank you.
Thanks.
Check, yeah.